Now some new information about yet another shortage that is impacting the healthcare industry. COVID lockdowns in China are causing a ripple effect in the healthcare world, and shortages of a crucial component used for medical imaging tests like CT scans. Here's where it starts. Lockdowns back in April, May, and June forced the closure of a GE manufacturing facility in Shanghai that makes what is called contrast dye. That highlights the different areas on the scan like you see here. Well, hospitals across the country and some here in Western New York have had to adjust while they wait for the supply chain to normalize again. I had the chance to talk with the director of imaging services for Catholic Health. He tells me at one point the hospital system was getting just 5 to 10% of the shipment that they normally would. Right now they're back up to around 60%, and shipments of that contrast dye keep improving as production ramps up again. Still, they've had to pivot to make sure patients don't miss out on important care.
A couple of things that we needed to do and are continuing to do are to push our outpatients to other facilities within the Catholic Medical Partners umbrella, which use a different manufacturer of contrast. We've also resorted to moving to different types of contrast that are specific to different procedures.
Now, health experts say this isn't cause for alarm, and they don't want people to put off medical care or think that they have to cancel their appointments. Franklin also said that there are alternatives to CT scans that also meet the required care standards.
A good example of that is a lot of patients who would normally get a CT for a particular indication would receive an MRI or an ultrasound instead. We did a lot of work to ensure that we would not exhaust our supplies of iodinated contrast and would always have that available to those patients who absolutely needed it.
And we also heard back from Roswell Park Comprehensive Cancer Center. They tell us that the hospital has resumed normal operations regarding CTs with contrast. But again, they're monitoring the situation here, across the country, and globally.